Good morning, everyone. Many thanks for joining us for the final instalment in our series of mental health webinars. As the economy starts to open up, many, if not all, businesses are looking at how they can reopen their offices. We can plan for all the physical challenges, sneeze screens, hand sanitizers, social distancing, etc. What is harder to plan for is the impact on mental health of a return to the office environment and the challenges we may all face. Today, Kate Appleyard of Apple HR is going to discuss this key area and suggest some ways in which we can reduce the mental health risks as we start to return to a more normal working environment. Over to you, Kate.
Many thanks, John, for that introduction, and good morning, everybody. Well, it's been quite a week for announcements and changes and planning to get business back on track. And there are all the practical things that we will need to cover to keep people safe in the journey back to work. But how many businesses are considering how to support positive mental health of their teams during this time? This morning, we're going to delve deeper into the considerations we recommend and hopefully provide you with some solutions to concerns and some quick hacks to keep your business moving. As we talk, as before, please consider your business, your people, and how you currently support mental health at work. And of course, let's not forget your own personal mental health in this journey. So we visited this slide in all three of the webinars, and I'm using it again because I feel that if you only take a few things away from these sessions, it's important for everybody to really understand what we mean by mental health. And the reason I'm so fixated on this is that it's not just relevant to the people that you come across at work, it's relevant to everybody you come into contact with. So your friends, your family, your colleagues, and very importantly, it's relevant to you. So for the final refresher, mental health is part of our overall health. There is no health without mental health. And it affects how we feel, how we think, how we behave. It affects how we cope with the ups and downs of our everyday lives and how we feel about ourselves and our lives and how we feel about ourselves and our future, how stress affects us. And very importantly, as we emerge from the pandemic, it will affect us all in different ways. At this point, we just don't have the knowledge to know the impact COVID-19 has had on our mental health. It's just too early to predict right now. We've had a lot to contend with in the last few months, and we should be conscious of this when we're communicating with our teams. The impact of lockdown has included social distancing and self-isolation. Some people are very fearful of contracting COVID. Some people are desperately worried about family, friends, their finances, their job security, having to go back and use public transport and venturing back into the workplace. And some of us have suffered bereavements whilst being in lockdown and have not had an opportunity to say goodbye or even to attend the funeral. That's an awful lot for us all to deal with. And we all respond to these factors differently. So some of us will be more resilient than others. And unlike physical health conditions, you might not be able to spot as easily the people who are not resilient and those struggling with their mental health. So the important message here is not to make assumptions about anybody and anything, but to ask, how are you? Mean it when you ask and really listen to the response. I read in a CIPD report that evidence from previous quarantine situations prior to COVID-19 have suggested that we expect longer term effects on our mental health. Previously, these have been across the spectrum from anger and irritability to depression and post-traumatic stress disorder. So we should be mindful of these as we move forward. So we've got this far. When we went into lockdown in the middle of March, the initial announcement of 3 weeks at home felt like a massive endurance. I wonder how we would have felt if we'd been told straight away that we would need to stay at home for almost 4 months. So it should therefore be no surprise that whilst we've all tried to homeschool, hold down jobs simultaneously, or stay at home on furlough with all the time in the world to contemplate life, that some of our normal health and well-being aspirations have possibly gone by the wayside. Last week, a client of mine told me there were three ways that we would emerge from lockdown. We would either come out as a hunk, a chunk, or a drunk. And whilst it was a bit of fun, and I held my hand up to fitting into the chunk category with all the home baking that's been going on, it's not far wrong, except it's missing one element. These three categories are relating to physical health, but can impact on our mental health too. And I wonder how many other people and employers out there have unintentionally missed that element when planning for the return to work of their teams. So as with anything employment, there's always the legal bit. Often it's quite heavy to wade through. So let's look at what that means for us. And having got this far and worked immensely hard to keep business moving during the period, what do we need to do next? We want to get back to work, but we know that without some careful thought and planning, this might not go as smoothly as we'd hope. So let's look at what we need to do first, as in what the law requires us to do. Though remember that the law always sets this as a minimum standard. And then we can consider what's good to do. And it's often the things that are good to do that will make all the difference to getting your teams back happy, healthy, and productive. And if you go that extra mile, your teams are more likely to reciprocate. So all employers have a duty of care to protect health and well-being. And remember that this covers both physical and mental health. Employees with mental health conditions could be defined under the Equality Act 2010 as being disabled. And this means that whilst they are employed by you, they're protected from discrimination. On this basis, you might be required to make some reasonable adjustments. And how you define reasonable will be dependent upon the individual circumstances, the disability, and the resources your business has to be able to make these adjustments. Often people think adjustments will have a cost to the business. However, it could be something as simple as considering changes to where the employee works, or reviewing the hours they work, the job they do, as well as considering purchasing equipment if necessary. But not all mental health conditions will be defined under the Equality Act, though it's good practice to support employees and where possible make adjustments irrespective of this. Be mindful also that not all employees will want to share with you that they have a mental health condition. That's the legal side of things. How are we going to get people back to work? So the most simple way to gain the trust and support of employees in this situation is to communicate with them. Share your plans. We can't go back to work exactly as it was when we left in March, so we need to explain what it will look like now. Provide them with the reassurance that you have considered what is needed to ensure the environment is as risk-free as possible. Allow time for them to get used to the idea of a return, rather than just dropping them an email saying, "See you Monday, usual time, usual place." There are many ways that you can communicate with your teams remotely. It could be via a group email, it could be a group video call, video messages, announcements, updates, newsletters. These are all just to name but a few. But also communicate individually. It's a good idea to treat everybody as if they were new employees arriving into your business for the first time, and consider all the information that you need to give them. Compile a reinduction form and reinduction pack of information, and then you can ensure that you're consistent in the questions that you're asking people and also in the messages that you're giving. You don't want there to be differences in messages across the workforce. And I would strongly recommend that you hold a one-to-one reinduction meeting. And that doesn't need to be with the same person throughout the business. You can ask your managers to do that to talk to their teams. They're the people that will be working closely with them. Make it a two-way conversation. Ask them questions like, how do they plan to get to work, and does this pose any problems for them? Get their input and listen to any concerns they may have. Check their current health, their physical health, as well as their mental health, so that they know if they are displaying any signs of COVID, then they ensure they know what to do. In the current situation, I would think it's unlikely that over-communication could be seen as a negative, so don't hesitate to keep sharing with them where you can. Everybody's going to need a risk assessment that's specific to this situation, and talking them through the risk assessment will be really beneficial. Explain the changes they'll see, and individuals struggling with anxiety will find this helpful. So the risk assessment, some of you might have done them, some of you might be looking to do them in the next few days. I'm hoping that you've already got a workplace risk assessment in place. And if you have, you can use that same template. It just needs to be COVID specific. If this is new to you, then there are a number of templates online that are really easily accessible. And the government have provided guidance on the gov.uk website in the form of working safely during coronavirus. And they've also published a number of guides available to specific business sectors. Now these, up until very recently, have covered construction and outdoor work, factories, plants and warehouse, labs and research facilities, offices and contact centres, restaurants offering takeaway or delivery, shops and branches and vehicles. Now, no doubt these will be revisited in the light of the easing of the restrictions that were announced on Tuesday, allowing more businesses to open. So your business might be within those categories, or it might be the guidance that's been released in the next few days. Explain within the risk assessments cleaning and hygiene rules, ensuring a focus is on the surfaces and the hands. Provide cleaning materials for all during the working day, as well as having thorough regular cleaning plans. Ensure the workplace complies with social distancing rules, and these have now been reduced to 1 metre, but be conscious that if the number of cases increase, then that could quickly be returned to 2 metres. I found that referring to current social distancing guidelines rather than 1 or 2 metres in documentation is far more flexible for the future. Otherwise, you're going to be constantly at risk of having to update your processes. Consider social distancing measures to include staggered start and finish times, altering seating plans, introducing one-way pathways around your workplaces, and where you're unable to remove the risk, take action to manage it. So, for example, is PPE necessary? Consider what you'll do about kitchen or canteen facilities. Will you allow visitors or clients to attend the workplace? And if you have more than 50 employees, you'll need to publish your risk assessments to evidence the changes that you've made. But I would suggest that even if you have less than 50 employees, it might be helpful to them if you are prepared to publish the risk assessments anyway. It's also worth mentioning that your employees are under an obligation to understand your safety measures and to comply with them. So unless you are sharing these with them, they won't know what it is they need to comply with. And so part of that communication process should be to ensure they understand their responsibilities and their obligations, particularly those in relation to working alongside their colleagues. So I mentioned in detail the risk assessment, which is physical as well as mental, partly because that will impact people who are struggling with their mental health and give them some peace of mind to know that you've considered all the eventualities. So every workforce is different, and each of you will employ different groups who will all have different concerns. Some will be concerned about returning from furlough. When will it be? What will happen? So you need to consider the best approach to this for both the business and the individual. Will you bring everybody back from furlough at the same time, or will you stagger it? If you're going to stagger it, how will you decide who returns first, and how will you communicate to this to the team? And what impact will your decisions have on individuals? Because it's really important to realise that every decision that you make will have an impact. Do they have children at home who are unable to attend school before September? We're nearing the summer holidays, so surely things will be okay at this point, but will they? Many people like me will be hanging on to see if the normal holiday clubs will be opened up to allow us all to get back to work. But what if they're not? And how will that impact your employees? These are just a couple of examples of the concerns individuals may have. We need to acknowledge that with this new positivity of returning comes concern for everybody, and ensuring these areas of concern are discussed openly in the return to work induction form and one-to-one conversations that we referred to on the earlier slide. Ask them how they're going to cope with their own situation, what's the impact of them, and what are their coping mechanisms to help themselves. I would really encourage you to offer support in the form of mental health activities like face-to-face socially distanced catch-ups in the workplace where you can. If you've got some outside space at your business that you could utilise to get people together in the first few days, weeks of return. In an earlier session we talked about fika, which is Swedish for coffee and cake. So providing this can be done within the guidance, it's a great way to start getting the teams back together. For those of you who may need more support, consider introducing an employee assistance programme, an EAP. These offer personalised specialist assistance in the form of counselling and referrals, and they can be a benefit to both employees and employers as they provide confidential support which assist in keeping people at work and or facing up to their mental health issues and accessing the help that they need. Last week I mentioned Champion Health, who are a new online mental health training provider. They've been providing mental health training free of charge during lockdown and have just secured crowdfunding to extend this for another month. So you could look at this and roll this out now to all your teams at a critical time, and it'll provide them with some reassurance that you are seriously considering appropriate support at a cost of nothing to yourselves. Consider support for your managers, upskilling them with increased mental health awareness. Is there a webinar they can join to learn more? Is this something you want to consider designing specifically to your business? And I mentioned Champion Health as a bit of a quick and a free hack for you. Another suggestion would be with regard to businesses planning a phased return to work, which is going to allow limited people back into the workplace at any one time. Sometimes the organisation of this can be time consuming and challenging to manage shifts and rotas by spreadsheets. And if this is only going to be for a temporary period of time, do you really want to put all that effort into doing this? But if this is something you are considering, a quick hack that might save you some time is the online HR platform, Breathe HR. So I've become aware that they are currently supporting small businesses through this period by offering a free subscription to their automated rota until the 1st of January 2021. So it might just provide you with a solution during this recovery period before bringing everybody back to business as usual working hours. Just something to consider. I've spoken to many businesses in the last few weeks who have employees who are reluctant to return to work. And I don't suppose that should be of any surprise to us. But when I ask them why are the employees reluctant, some employers don't know the answer to that because they haven't asked the question. So they tell me, oh, it's because the employees got too used to laying in bed or enjoying the sunshine or, many other reasons. But they've simply made a lot of assumptions rather than ask the question, and this may result in causing unnecessary distress to the employee and numerous unnecessary hours of the employer's time trying to resolve the situation. At the one-to-one reinduction meeting, ask them if they are worried about anything in relation to returning to work. Let's be upfront about it, because some of their concerns might actually be easy to resolve. One I had this week was that someone was unclear of what to expect in relation to levels of hygiene and simply needed some clarity on this to put their mind at rest. But I think without having the opportunity to have that discussion, it might have been more difficult to get them back to work. And this would have put a prolonged extra strain on themselves and the business, and all it took was a conversation and some information. So the notes that you see on this slide illustrate a response I received when I spoke to an employee who was reluctant to return to work. Many of her colleagues had returned over the last few weeks, and she just wasn't prepared to join them. She said that she was working well from home, there was no detriment to the business, and therefore, as the government guidelines asked people to work from home where they could, then this was her plan for the foreseeable. Her manager felt quite differently and wanted to be more firm in the approach, but she hadn't actually asked the employee why they didn't want to return, and asked me to pick up the situation because they felt nervous about dealing with it and also felt quite angry that they weren't getting the same positive response towards returning to work that they were looking for. So I spoke to the lady, and once I'd gained her trust, she explained to me that she'd suffered with mental health conditions since being a teenager. And other than one episode where she had been prescribed medication, she'd been able to take control of the situation using a variety of coping mechanisms that she'd tried and tested over the years. She hadn't disclosed her condition to her employer simply because she didn't want to. And then came COVID-19, which had knocked her back dramatically, and quite simply, she didn't know where to start. So she'd been hiding behind the government guidelines regarding working from home. Where do you go from there? Because despite the conversation, the situation hadn't changed and the employee still wasn't intending to return to work. So for the next couple of weeks, we agreed to diarise a call, and we caught up on how she was, what had happened in the week, the highs and lows for her from an anxiety perspective. I explained what we were doing within the business to regularly review the situation and to respond to any further risks as we moved forward. These conversations were very positive, and this employee was really grateful that the business had made the time to engage with her. So we then agreed that the next week she would come to work. She was very nervous, so she was going to call me from the car park. And I went down and sat outside in the fresh air with her and discussed how she was feeling and her fears at that point. And after a while, she felt relaxed enough to enter the building with me, and I walked her through all the measures we had to reduce and remove risk. She was so pleased and surprised to see all the hand sanitizer, the thermometers, the beautifully branded screens on the desks to keep her safe. And she only stayed in the workplace for a matter of minutes as it all became way too much for her. And once we got back outside, she was physically shaking, but so pleased that she'd done it and pleased with what she saw. So we sat down again outside and giving her the opportunity to compose herself and ask any further questions. She then said that she'd be keen to see the risk assessment and understand the written protocol for hygiene in the toilet areas. And she then felt ready to discuss the next steps with me. So I agreed to send her all the documentation she needed, and we arranged another call once she'd had time to go through that information. And we also put a date in the diary for her to come into work and hopefully work in her employer's premises for a 2-hour period the following week. Now, I appreciate that these are all really small steps, and I also imagine some of you are listening and thinking that you just simply don't have the time to do this or even feel comfortable to have those conversations. And I've shared this situation in so much detail with you because it's a very real example of how people are feeling right now. Not everybody, but some people. And in a time when, businesses have got so much to consider, providing time and support can be difficult. When faced with situations like this, don't be judgmental. Consider that there just might be more to it than you're aware of. And although your time is precious, spending time on supporting your teams now will save you time and money in the long run. It could avoid months of absenteeism, sick pay, medical reports, management time. And if you look at it from the employee's perspective and think it through to the extreme, investing time right now might just save someone's life. Invest in your managers so that they have the skills to manage mental health situations. Give them the skills, the support, the credibility to stand up there and be an ambassador for your business and reassure, support, show kindness, gain trust, signpost, remove the stigma. The positives of this are absolutely endless, but never underestimate the impact supporting someone struggling with their mental health could have. So what happens if that doesn't work? What happens if you have employees point blankly refusing to return to work? And as the lockdown restrictions ease, there is more opportunity for the majority to return to work, but do consider the following. Are they shielding? The government advice this week is that anybody shielding can return to work from the 1st of August. Are they vulnerable in some other way? And therefore, is it possible to keep them away from the workplace by possibly working from home or remaining on furlough where this is applicable? Another option might be to allow them to use some annual leave if they've accrued it. We mentioned childcare issues earlier, and I would really urge you to try to be flexible on this. You could consider unpaid parental leave until the schools reopen in September, but in the majority of cases, parents are keen to return to work, and it's just a situation that is going to improve in a period of time. It's just how can we support them between now and then. But what happens if your employee doesn't fall into those categories and is simply refusing to return? Well, providing your workplace is COVID secure and you can provide evidence to show this, if your employee fails to attend for work, then this might amount to a failure to follow a reasonable instruction, part of your policies and procedures. And this may lead to a disciplinary process and putting them on unpaid leave for the period whilst the employee refuses to attend. Whatever decision you take, please remember that a blanket approach for all employees is really unlikely to get results. One-to-one communication in these situations is key. Supporting people in this way may be new for you, and it might be new for your managers, and don't underestimate the impact that this can have. So ensure you look after your own mental well-being and those of your managers. And we looked at this last week, covering some resources to do this, looking at coping mechanisms and learning to care and look out for each other. Ensure you know what your triggers are, your coping mechanisms are, and that your managers know theirs too. And ensure that your manager knows who to talk to if they are struggling. In the current climate, employers are acknowledging that the pandemic has posed a huge challenge to many employees for reasons that we've already covered. Businesses are considering how to support as we emerge from the struggle. And I just wanted to share with you an example of that challenge that has been the ability to properly separate your personal and your professional lives and take a regular break to prevent stress and burnout. And that's for you as a business owner, for you as a manager, for you as an employee. In May, the employer Indeed hosted a U Day, where employees were gifted a day off to tackle COVID-related stress and racist violence in their communities. So following this, indeed have gifted all their employees an extra paid day of annual leave for each month until November 2020. I'm not saying this is going to be possible for all businesses right now, but there may be something that you can do that would go a long way to support. Yesterday, I was considering this with a client, and one similar option we considered was to extend the August bank holiday weekend by gifting Friday the 28th of August as an additional holiday, and therefore allowing a prolonged bank holiday weekend. Time might not be something that you've got right now to share with employees, but there are other things that you could consider which don't have to cost a lot, but as a gesture would be very much appreciated. And my final message remains the same. Everyone in your business has mental and physical health. You will have strategies to support physical health. Ensure you've got the same for mental health. And in both the long term and the short term, I can assure you this will save your business money. Having a well-being or a mental health strategy is absolutely proven to help with presenteeism and absenteeism, and this includes reducing levels of absence cost, increasing levels of productivity, and increasing levels of engagement. I hope you've learned something today. Many thanks for joining us, and if you've been with us throughout all three, many thanks for sticking with it. We're just going to check the question chat and let you know if we've got any questions this morning, but otherwise enjoy the rest of your day, and I hope you get some opportunity to take advantage of the sunshine. Many thanks. I'll pass you back to John.
Hi Kate, thanks for that. Absolutely excellent, and lots of great advice, and particularly like the two hacks for the free material on Champion Health and Breathe HR. We've just got one question in, which is, I run my own small business with 10 people relying on me. Who can I turn to for assistance with my mental health?
Okay, well, I suppose the first port of call would be family and friends, if you're confident to do that, and if you feel you've got that relationship and you're comfortable that there isn't a stigma attached to that. There are lots of resources online, and if you look at Heads Together, if you look at Mind, if you look at Mental Health First Aid England, they will be able to point you in the direction. If you find that you're really struggling with your mental health, then I would definitely signpost you in the direction of your GP to start with. They will be able to provide you support, and I don't just mean medication. They will be able to provide you with other support. But there are a number of charities out there that aren't huge, that do have people that you can talk to. And thinking locally, you could look for your most local Andy's Man Club out there. There is another organisation that's been launched recently in the Leeds area, which is Jordan's Legacy. And there's a gentleman there called Steve Phillip, who is working closely with the guys at Champion Health. And they've got lots of resources there that you would be able to access. I hope that helps. Yeah, no, that's great. So in the absence of any other questions, I just want to thank you, Kate, for the effort and content that you've put into the 3 webinars that we've run. The feedback we've had has been absolutely great. So thanks a lot, and I just want to wish people who've dialed in all the best for the rest of the day.